At the Bureau of Certification, we're aware of the commitment it takes to be a successful director. The most critical component of being successful in the role of director is to be in compliance with the licensing or certification regulations that assure the health and safety of children at all times. Directors must know and understand their responsibilities and follow through with those responsibilities to effectively run a program. Whether a director has been in the role for years or is new to the position, the tasks are the same. A child care director is the person in charge of managing a child care center, including overseeing, hiring, budgeting, and policy making. A successful child care director must be committed to providing a safe and healthy environment where children can learn new skills, explore, imagine, and discover. Good directors have the organizational skills necessary to manage day-to-day operations, as well as the interpersonal skills needed to communicate effectively with employees, parents, and children. Directors need to have a comprehensive knowledge of DHS regulations and to effectively communicate their expectations to all staff.
A director oversees the day-to-day operations of a program as far as files and paperwork go, daily interactions with staff and children and their parents or their families, as well as the certification office. They ensure that the staff and all of the classrooms are meeting all of the regulations that are set forth in the state of Pennsylvania. Their main job for us is to ensure that the facility is meeting all of the regulations on a daily basis. And if not, that they are correcting those violations. They work with staff for professional development. They make sure that they are hiring appropriate staff and staffing the classrooms appropriately. They make sure that they are supervising those staff that are hired as well.
So how do directors begin this process? Let's review the top 10 guidelines for your first day in the director's role. Share your vision and goals with the center staff and with the families you greet. Include how your program provides quality service to children and families, while at the same time assuring the health and safety of all children. Visit all the classrooms to show the staff your commitment to the program, to the children and families, and to them. Interact in the classrooms with the children and staff in positive and helpful ways. Reinforce the importance of maintaining staff-child ratios and model appropriate supervision. Appropriate supervision is critical to maintain for all early care and education settings. When talking with staff on the first day in your role as director, define appropriate supervision.
The way that we define supervision is that staff must be able to see, hear, direct, and assess children at all times. All times when they are directly responsible for a child, they must be able to do all four of those things.
Know and understand the DHS regulations. Make sure you have a current electronic copy of the regulations, easily accessible on your computer. Have hard copies available for staff to review and for families to review. Post a copy of the regulations in a main area and visible location for families to view. For example, near the entranceway on a family information bulletin board.
So beyond just having the required, educational hours, the required, clearances, and all the things that go into your file, I think having an understanding of the regulations is vital for any director, but specifically a new director. When you're looking at a director, we have tools. We've developed tools in the last year or so that really will help them. There's a self-assessment tool that directors can use now that you can go in, and it's basically what you're going to be looking at, the same thing I'm looking at when I come in and do an inspection.
Schedule a staff meeting for soon after you begin in your role as director. This meeting provides an opportunity for you to get to know your staff and to begin to build positive relationships with your team. During this meeting, you may discuss your vision for the center, review DHS regulations and center policies, answer questions from staff, discuss staff concerns, and provide support to staff.
The director needs to train staff and not assume that because you're hiring a staff from another facility or that worked in childcare before, please don't assume that they have a very good understanding of the regulations. You cannot assume that.
I think it's very important for a new director entering a facility to make their expectations very clear to staff, both about supervision and about all of the regulations. I think having a written policy in place that staff can see exactly what those expectations are is very important. And a director sets the precedence of how important supervision and meeting all of the regulations can be. If a director makes those expectations very clear from their first date of working with the staff, that's all the staff know. They know that that person does take supervision seriously and will implement it as such.
Determine in advance of the meeting the staff person who is in charge when the director is not there. This person is responsible for knowing and being able to implement the DHS health and safety regulations, and to support the operation and management of the center when the director is not present. Clearly communicate this information to the staff at the meeting. A critical component of directing a program involves keeping all staff and children's files and emergency contact information up to date. Locate the employee files and determine if there are adequate procedures in place to ensure that all staff have up-to-date background checks, including child abuse, criminal, and FBI clearances. Plan to review the files for other required staff information, including, but not limited to, qualifications as per DHS regulations, health appraisals, and documentation of training.
For a new director, I would encourage them to look through the staff files and become familiar with the staff and all of the documents. They should notice that the documents that are in staff files are relatively similar as they're going through. I would encourage them to go on our website and look at the staff data sheet and print a copy out, if not already on file at the facility. For certification, that's what we use for a renewal inspection every year. So it gives the director everything that we would be looking for in a staff file and everything that's required by the regulations to be in a staff file. Directors are responsible for maintaining those staff files. So as staff are being hired and required to have all of that paperwork, it's up to the director to enforce that. It's also up to the director to monitor and ensure that paperwork that is required to be updated is being updated on time. We review those on an annual basis when we come to the facility to do a renewal inspection, but it's still up to the director on a day-to-day basis to make sure that they are maintaining those files correctly.
Plan to review the content of the children's files for required information. Make certain that all information is current and that all required information is listed. If there is incomplete information, follow through immediately on completing the required information.
If a director is unfamiliar with what's required of a child's file and can't really determine that from the previous director, we encourage them to reach out to certification so that we can tell them exactly what we will be looking for in a child's file. There are many different places in the regulations that speak to what should be in a child's file, so we encourage the providers to really read the regulations from beginning to end so that they can make note of everything that's required to be in there. Children's files, certain paperwork is required to be updated every 6 months. A fee agreement and an emergency contact form must be updated by the parents at least every 6 months. The only way for us to assess that is if the parents sign and date those emergency contact forms and the agreement forms appropriately. And it's up to the director to maintain those files.
There's so many things that a director is in charge of. And files, sometimes it could be a little bit tedious, but it's important and it's necessary. In regulation, it states what needs to be in all the files, and that should be followed.
Make sure you have the updated emergency contact information for all children in the center. Staff should have children's emergency contact information immediately available to them.
From a practical standpoint, you need to make sure your staff can access those important child documents. In the event of an emergency, they know where the emergency contact form is and they can get it. So it has to work for you, and then it has to work for the bigger picture of everybody around them.
It is also critical to have emergency plans up to date and in place. Locate and have available the emergency plan that is in place for the center and that has been shared with the county emergency agency. Share this information with your staff. Get organized with a master calendar listing any upcoming events. Some examples of things to track on a calendar: any DHS violations that must be corrected, end dates for those corrections, payroll and employee benefit events, staff meetings, and parent conferences. Use the calendar to help you organize, prioritize tasks, and to create a list of weekly and monthly tasks to complete.
It's a lot, and you are busy. Typically, the directors, are on the floor or in rooms or dealing with, kids. So have something, I would say a system, whatever system works for you. If you have to handwrite something, great. If you type something up on the computer, great. Go through the regs, get to know what needs to be on those forms, get to know what needs to be in the files, make that checklist, keep it in each file, and use it. Again, if you have a great checklist, that's awesome, but if you're not using it, it's not helping you. But I always say when people are opening, develop your systems first.
You're going to need to be the one who's monitoring when does that child need a health assessment? Am I signing this emergency release form? Am I reviewing it every 6 months? Do my staff need a physical? Do they have all their clearances in place? When do their clearances expire? Did they get their TB test? Did they take their 6 hours of training, or their hours of professional development for the year? What things are in there? And that's all on you. So you need to make sure that you manage that in a way that's comfortable for you. From a purely certification standpoint, making sure you know what you have to have and where you have to have it, and when it's due, and how everything kind of rolls, that's important.
Be a role model for your staff from day one. Show respect, encourage involvement, and support a positive climate in your center. Successful directors are able to manage the big picture responsibilities in a center, as well as the day-to-day operations.
The biggest thing I can recommend to new directors is to read the regulations. What we're looking for when we come out to inspect a facility is not a secret. It's all in the regulation book. We encourage providers, especially new directors, to really read and jot down questions that they may have as they're going through the regulation book or going through the regulations, and contact certification if they have questions so that we can clarify them. We always have certification staff on call that they can answer questions, whether they're simple questions or general questions, or whether they're a little bit more specific. We can always get you the help that you need.
Understanding and complying with the certification regulations helps the director keep children healthy and safe, and promotes a strong early childhood program.